Hello everyone, this is me, Dr. Zuhair Hussain, with my bosom buddies Dr. Shahid Khan, Dr. Tariq Aziz, Dr. Muhammad Abbas Khan, Dr. Hamza Jahangir, and Dr. Saad Ahmad. I welcome you all on behalf of Pharma-Leaders. Hope you people will be fine. Once again, we come up with another interesting and informative video for you. So let's enjoy the topic with us. Today, I will present you stroke. Let's have a look to the slide that what we will cover today. First of all, a little bit introduction to stroke, then definitions, then type of stroke, causes of stroke, pathophysiology, symptoms of stroke, risk factor for stroke, complications, prevention, diagnosis, and then last, treatment of the stroke. So today is going to be a lot of fun, and don't get bored with the content of stroke. It will be easy and you people will gain a lot. Starting with introduction of stroke. It is stated that stroke is the third leading cause of death in US and approximately 60,000 people suffer from this disease annually. By comparing the incidence of the stroke, the CDC Center for Disease Control says that the incidence of stroke is greater in male as compared to females, and they gives the reason of hypertension, that approximately half of men have high blood pressure. But according to UT Southern Western Medical Center, females are at high risk due to postmenopausal changes. But this is the fact that as the age grows, the chances of stroke increases in both genders. Definition of the stroke, that what is stroke? Stroke is also termed as cerebrovascular attack or brain attack. It may be defined as the disease that affects the arteries leading to and within the brain, or stroke occurs when the blood vessels that carry the oxygen and nutrients to the brain is either blocked by a clot or burst, means rupture. So, stroke affects the blood vessels by either blocking it or rupturing. The reason behind the rupturing and blocking of the blood vessels are high blood pressure, high cholesterol, smoking, obesity, and diabetes. Now, when the blood vessels are blocked or ruptured, the oxygen and nutrient carrying capacity will be diminished, and ultimately the cell and tissue will die. So by this way the stroke will occur. I hope it is clear to you people that what is stroke. Coming toward the types of stroke, there are three main types of stroke. Number first is transient ischemic stroke. In transient ischemic stroke, the clot will form for a while and reverses on its own after some time, like it is dissolved within 3 hours. Number second, ischemic stroke. Most common stroke occurs approximately 85%. In this stroke, the clot or plug will be formed in the blood vessel and block the blood vessel, and usually the time for this stroke is more than transient ischemic stroke. Number third one, hemorrhagic stroke. It is less common, approximately 15% occurs, and it is occur due to either burst or leakage of blood vessel that seeps into the brain. So simply the difference between the three ones are that the transient ischemic stroke reverses on its own, and ischemic stroke involve the blocking of the artery, and hemorrhagic stroke involve the bursting of the blood vessel. Causes of stroke. The causes of stroke depend upon the type of stroke. First one, transient ischemic stroke. It is also referred to as TIA or mini stroke. When the blood to the brain is temporarily blocked, it will cause TIA. Their symptoms are almost similar to full stroke, but it will be restored within a few minutes or hours when blockage is removed. It may last for 24 hours or restored in 15 minutes, but it resolves mostly in 3 hours. Transient ischemic stroke is not a full stroke, but it is a warning for full stroke. so it is not be ignored. According to CDC, the people who have transient ischemic stroke and not treated will experience stroke within a year, and up to 10 to 15% people will experience within 3 months. Second one is ischemic stroke. When the blood vessels become narrow and blocked, it will cause ischemic stroke. The blockage are of two types. Number A, cerebral embolism, referred to as embolic stroke, when the blockage are pumped in other part of the body and move through blood and hit the artery to become it narrow and get stuck to stop the blood flow. The second blockage is cerebral thrombosis, referred to as thrombotic stroke, when the blood clot develop a petty plaque within the blood vessels. Third cause of stroke is hemorrhagic stroke, when the blood vessel breaks and leaks the blood to the brain cells and tissue and create excess pressure on the brain. It will cause the hemorrhagic stroke. There are two types of hemorrhagic stroke. First one is intracerebral hemorrhagic stroke. It is most common. It will happen when the surrounded tissue of the brain fill with the blood after the bursting. Second one is subarachnoid hemorrhage stroke. It is less common and causes the bleeding in area between the brain and tissue that covers it. Pathophysiology. Now understanding the pathophysiology of stroke. When the blood vessel ruptures and blockage occur, how it leads to stroke and cell death will occur. First of all, when blood vessels which is to be blocked or ruptured, the blood flow will reduce to cell and tissue. We call that ischemia, and due to reduced blood flow, oxygen and nutrient supply is diminished. So energy failure occurs. Due to energy failures, ions will disturb and acidosis will occur. When less ATP is produced, leads to the interior of the neuron will be less negative and more positive, and leads to the forcefully opening of the calcium ion gated channels. Unnecessary influx of the calcium causes the release of the excess of glutamate into the synapse. That will slow down the intracellular protein synthesis, and cell injury will occur, and ultimately cell death will occur. So these were the steps involved in the pathophysiology of stroke. Stroke symptoms. There are some common symptoms which we will discuss in these slides, but the symptoms of stroke depend upon that which portion is damaged. Please have a look to the figure. If the right portion is damaged, then the symptoms will be like paralysis of the left side. Spatial perceptual deficit means difficulty in pointing the location of something the patient see, hear or feel. Quick impulsive behavior style means acting quickly with no one thought to the consequences. Memory deficit means unusual forgetfulness. And when the left side of the brain is injured, then the symptoms will be like paralyzed right side, speech language deficit, slow, caution behavior style, memory deficit. Other common symptoms include numbness or weakness in arm, face and in legs, confusion, sudden behavior change, vision problem, walking problem, dizziness, headache, nausea and vomiting. Stroke require immediate medical attention, otherwise the patient may lose their life. Risk factors for stroke. There are some factors which make you more susceptible to stroke. If we kept these factors in mind, the chances of stroke will be really reduced. According to the Heart, Lung and Blood Institute, the risk factor for stroke include first, diet. An unbalanced diet, and the type of the diet is in high salt, saturated fats, trans fats and cholesterol, will increase the risk of stroke. Another risk factor for the stroke is inactivity, means lack of exercise. The CDC recommended that every adult should do 2.5 hours of exercise in every week. This will decrease the risk of stroke. The third one is heavy alcohol use. The risk of stroke also increases with alcohol use. Due to alcohol, blood pressure will increase, and increase in blood pressure can increase triglyceride level, which can cause arteriosclerosis. It will form plaques and narrow the blood vessels, lead to stroke. And according to the research, a man can drink only 2 glasses a day and a woman can take single only. Number fourth one is tobacco use. In any form, tobacco can increase the risk of stroke because tobacco contains nicotine, and nicotine increases the blood pressure and ultimately lead to stroke, as we studied in case of heavy alcohol use. Another factor is personal background, which include family history, age, and race. Some families are at high risk due to genetic problem, and the older are more susceptible to stroke as compared to young ones, and some races like American and Africans are at high risk. Another factor is use of illicit drugs. Some people use drugs like cocaine and methamphetamine can have also stroke. Another risk factor is health history. Some people have medical issues which are linked to the stroke. These include a previous stroke, high blood pressure, high cholesterol, carrying too much weight, heart disorder, heart wall defect, enlarged heart chambers, sickle cell disease, diabetes, obstructive cell apnea, blood clotting disorder. So the patients with such diseases are also at high risk to stroke. Complications of stroke. Some complications which are interlinked with stroke are seizure, means a sudden uncontrolled electrical disturbances in brain, loss of bladder and bowel controls, cognitive impairment, means a person have problem in remembering things, reduced motility, depression, mood or emotional changes, shoulder pain, bed sore, sensory or sensation changes. So these were some problems which were associated with strokes. The above complications can be managed by medication, physical therapy and counseling. Next one is how to prevent stroke. If we change our lifestyle, the chances of stroke can be prevented. These changes include, first one is quit smoking. If you are smoking, then quit smoking and consult to your doctor to create a better plan for you. Preventing stroke, the next step is limit alcohol use. If it is difficult for you, then consult your doctor. Next one is keep a moderate weight. Overweight and obesity increase risk of stroke. To help manage your weight, eat balanced diet and stay physically active. Next one is get regular checkup of blood pressure, cholesterol and other health conditions. Different types of tests are performed for the diagnosis of stroke. Blood tests are done to check the blood sugar level, whether you have an infection or not, platelet counts, how fast your blood clots and cholesterol level. Another diagnostic technique is MRI and CT scan. MRI is abbreviated as magnetic resonance imaging and CT scan is computed tomography scan. An MRI can help see whether any brain tissue or brain cell have been damaged or not, and CT scan can provide a detailed and clear picture of your brain. Next one is ECG. ECG is heart related diagnostic technique to check the heartbeat and heart rhythm. ECG is performed to determine whether you have any heart conditions that may have led to a stroke, such as prior heart attack or atrial fibrillation. Other techniques are cerebral angiogram, carotid ultrasound, echocardiogram. Cerebral angiogram offers a detailed look at the arteries in your neck and brain. These tests can show blockages or clot that may have caused symptoms. Carotid ultrasound. A carotid ultrasound is also called a carotid duplex scan, can show the fatty deposits or plaques in your carotid arteries. Echocardiogram can find sources of clot in your heart. These clots may have traveled to your brain and cause a stroke. Stroke treatment. After the diagnosis, we need to treat the patient properly at proper time. As stated by the American Heart Association and American Stroke Association, time lost is brain lost. Let's start the treatment of the stroke, but the treatment of the stroke depends upon the type of the stroke. Ischemic stroke and transient ischemic stroke. Both involve the blood clot and blockaging. So, both are treated with similar techniques. They can include clot breaking drugs. Thrombolytic drugs can break up the blood clots in your brain arteries. One such drug includes tissue plasmogen activator (TPA). This is the only drug approved by the FDA for treating the ischemic stroke and transient ischemic stroke. The procedure used for treating the hemorrhagic stroke is coiling, in which a long tube is guided to the area of hemorrhage or weakened blood vessels. Then install a coil-like device in the weak wall. This will reduce bleeding. Another method is clamping. During imaging test, when aneurysm may discover. What is aneurysm? It is a rounded swelling in the blood vessel. To prevent the additional blood loss from that rounded swelling, a surgeon may place a tiny clamp at the base of the aneurysm. This cuts off the blood supply and prevents a possible broken blood vessel or new bleeding. Another technique for ischemic stroke and transient ischemic stroke is mechanical thrombectomy. During this procedure, the catheter is inserted into the blood vessel inside the brain, and by using a device, pull the clot out of the vessel. It is a successful surgery and performed after 6 to 24 hours after the stroke begins. Another technique is stent. In this procedure, the doctor inserts the stent to support and inflate the narrowed artery. Treatment of the hemorrhagic stroke. Hemorrhagic stroke caused by the bleed or leaks in the brain require different treatment strategies. Treatment for the hemorrhagic stroke include medications. Unlike an ischemic stroke, if you are having the hemorrhagic stroke, the treatment goal is to make your blood clot. Therefore, you may be given the medication that counteract any blood thinner you take. You may also be prescribed the drugs that can reduce the blood pressure, lower the blood pressure in your brain, prevent seizure, prevent blood vessel constriction. In the previous slide, we talked about the aneurysm, that what is aneurysm and how clamping is done. Now, in case if that aneurysm has burst, then the doctor may do surgery to clip the aneurysm and prevent the additional bleeding. So that was about surgery. Until now, we discussed the physical method to prevent the hemorrhagic stroke like coiling, clamping and surgery. Now we will discuss the medication used in hemorrhagic stroke. Several medications are used but depend upon the condition. Doctor will prescribe the medicines, and the main goal of the medicines is to prevent a stroke or to treat the stroke. The most commonly used medicines are: in medication we used direct acting oral anticoagulants in the same way as traditional anticoagulants were used. And the purpose of the anticoagulants is to reduce the ability of blood to coagulate. Secondly, we used tissue plasmogen activators. This is the emergency medicines given during the stroke within 3 to 4.5 hours after the symptom of the stroke begins. Tissue plasminogen activators are injected to the blood vessel so that it can start work quickly and reduce the complications of stroke. Antiplatelet drugs are used to prevent the clots formation. Most commonly, antiplatelet drugs are aspirin and clopidogrel. These antiplatelet drugs are important in preventing the secondary stroke, and it is mostly used in ischemic strokes. Statins are the drugs that lowers the high blood cholesterol level. These medicines are most commonly used in United States. Statins are the drugs that prevent the production of an enzyme that can turn cholesterol into plaque and cause stroke and heart attack. What is plaque? Plaque is a thick, sticky substance that can build up on the wall of the arteries. So statins prevent the plaque formation from cholesterol, and the most commonly used statins include rosuvastatin, simvastatin, and atorvastatin. Blood pressure drugs. High blood pressure can cause pieces of plaque build up in arteries, and these pieces can block the arteries, causing a stroke. So we will use the medicines that lower the blood pressure and help us to prevent stroke. Thanks a lot for watching our video, and if you need this topic in document form, you can download it from the description. You can also watch our previous topic rabies from the description. Feel free to ask any question in the comment box. Special announcement for you people. If you people want us to make a specific topic for you, please comment the name of the topic, we will make it for you. And especially we will highlight the name of that person in our video. And last, if this video is beneficial for you, please don't forget to subscribe our channel Pharma-Leaders. We always uploading such content that help you. This channel is specially for you and we need your support.